Trauma and negative self-talk. I'm Dr. B, psychiatric nurse practitioner with over 20 years of clinical experience, and I created choice mapping. I truly believe that choice mapping makes you mentally stronger, and I believe that you can learn to incorporate it in your life. We put out videos on Tuesdays and Fridays all about how to use choice mapping to make you mentally stronger. Today I'm going to be talking about trauma and negative self-talk. And as I was preparing for this video, I was talking to a friend who has a lot of personal trauma. And we talked about her negative self-talk. And I realized that almost everything she negatively believes about herself, I believe about myself. And I don't think that I've had significant trauma. And so I want to reiterate that this is why we put things into these 10 categories, right? So in choice mapping, we take a thought map and we identify and organize things into different sections. And trauma is a section and negative self-talk is a section. And we all have some negative self-talk that we tell ourselves. And we, as someone who is always into self-improvement, I am constantly battling those negative self-talk. So if I think I'm fat, I will say to myself, no, you're not fat, you're healthy. I will constantly work on kind of counteracting those negative self-talk with positive self-talk. But today I want to identify where trauma contributes to those things, but they are separate, right? We have to, process and grieve trauma, grieve how it has changed you, right? So if you're doing a thought map and your trauma comes up and some of this negative self-talk comes up, right? Where did that trauma contribute to the negative self-talk? And we have to grieve that. We have to grieve how that trauma changed you. Maybe before your trauma, you were innocent and you felt confident about yourself and you felt pretty, and then now you don't, or the trauma caused you to feel differently about yourself. Identify that. In the trauma section, we're actually having to grieve that. You have to grieve that loss. You are changed forever. However, you don't have to be changed in a negative direction. We can be stronger because of this, right? So identifying those negative self-talk, finding a way to counteract it, right? If you have complex, prolonged trauma, it is more difficult. Because over and over and over again, these things were kind of ingrained in you. But you have to identify them. You have to acknowledge them. And I'm not saying ruminate on them. And this is where it's super important, okay? It is not about, believing these things. It's about not believing them. It's about cutting that cord. These negative self-talk, it's like it's a cord that's holding you back. And it's hard to continue to grow and to be mentally stronger. And I'd like to say choice mapping makes you mentally stronger because I believe we are all already strong, especially if you have survived trauma. You are a survivor. You are functioning. You are alive. And you are strong. But wherever you are in that healing process, you can be stronger. And so keep working at it. And when it comes to those negative self-talk, identify where your offender kind of created that negative self-talk and give it back to them, right? I heard a story that really affected how someone feels about their body. When they were not a mature body, they were being sexually molested, and their offender, when they started to develop and get a little fat on their body, get boobs, hips, the offender began to call them fat and that they were going to be fat. And obviously that offender likes a body that looks like a child. And then, so the development became a negative, right? And then they got into a relationship that was sexually abusive and rape, and then the beauty of that development became a negative as well. And so that doesn't belong. If that is you, that doesn't belong to you. That belongs to your offender. So I encourage you to take the time to love yourself, to take those negative self-talk that somebody else gave you and give it back to them. It doesn't belong to you. It belongs to them. And learn to love yourself. And we all need to be doing that, right? Like I said in the beginning, these same things, I don't know if it's our culture, these little things that we hang on to, but why do I believe sometimes that I'm fat, right? I'm not fat. I can intellectually know that I'm not fat. However, I feel it sometimes, right? And so we all have these things. Let's learn to love ourselves. Let's learn to take those negative thoughts and turn them into realistic, positive, empowering thoughts, because you are mentally strong.